Uh, Good evening, everyone. Today we are having Dr. Salim for the teleconsultation of Youth India Foundation. We welcome Dr. Salim for the teleconsultation. I would like Dr. Salim to introduce himself first.
Thank you, Isha. Myself, Dr. Salim Muhammad Khan, and I completed my MBBS and MD Community Medicine from Aligarh, India. And presently, I'm working as a senior consultant in the Department of Community Medicine in JNMC, NU Aligarh.
That's great, Doctor. Doctor, could you just tell us about the experience that you had regarding the COVID part?
As far as my experience is concerned, since my branch is more of a public health type, so I see it as a challenge of on both part, preventive part and
Yeah.
the curative part. Unfortunately, in our setup and even in our mindset, we are more focused on the curative part, not on the preventive part. So our health infrastructure from sub-center to PSC to CSC and the district hospitals were not prepared for this pandemic. So it shows us that we need to spend more on health, more on health infrastructure, and it should not be only on papers. No, there should be
Right.
some in physical form so that all can benefit it. Like initially, there was a problem of testing, then there was a problem of hospital beds, then there was a scarcity of oxygen, then there was a lack of injectables, there is a lack of paramedical staff, other staff, lack of ambulance. There was many things. Even we were not prepared for the isolation part, quarantine part. These are all difficulties that we faced. But as we know, we are preparing and our country is preparing. So now we are in a position to deal with such situation in future too.
Okay, so could you just tell me, right now there are not as many as that cases, but yes, could you tell me the reason why there are deaths occurring? Why? I mean, we are coming up with the vaccination as well and other treatments as well. So why there are still deaths happening?
Pardon, Isha, I could not get you.
Okay, I was asking, is like the death rate is not going high as what it was in the back last year, right? So right now we are having death cases not at that point,
I think
but
there
yes,
was
we are having
some
death
network
cases.
issue on your side.
Okay, could I just repeat it again? Are you able to hear me?
Your voice is
Okay, I think could you just check whether I am sounding well or not? Am I audible, Adi?
now you're audible.
Okay. I guess there is some internet connection. Okay, am I audible to you now? Dr. Salim, am I audible to you now? Okay, I guess there is an internet connection from your side. Okay, guys, Dr. Salim will be joining us soon. Till then, we would wait for this. Okay, I will just. Okay, yeah, Dr. Salim is there with us again. So, Dr. Salim, are you able to hear me right now?
Yes, yes, sir. Now you're audible.
Okay, great. So, my question was, we are facing that as well in right now. So it is not that as much as it was last year, but still we are facing deaths. So can you just tell me what according to it might be because the deaths are occurring as well now? What would be the reason for it?
Okay. And for this
Dr.
year it
Salim, there
was
is a
different.
lag. Doctor, there is a
But
lag.
in the epidemiology, there is one basic rule: agent, host, and environment interaction. That we all know.
Oh, I'm sorry, doctor, but there's a lag from your side. Could you just check it once?
Should I reconnect?
No.
Should I reconnect?
Yes, definitely.
Should I reconnect?
Yes, sure. Okay, so
Okay.
Dr. Salim will be
Just
reconnecting with us and they'll be joining the live session within a sec. Till then, I hope everyone is doing well, staying safe, and taking care of your health. Okay, we have Dr. Salim with us. Yeah, Dr. Salim, I hope everything is going well with the internet issues right now and you're able to hear me.
yes, now I'm able to hear you.
Yeah,
Okay.
sure. Could I just continue with my question?
I think your question was what was the challenges in the last year and the and this year? What was the difference and how we
Yeah,
should tackle
I was
this?
talking about the deaths. Yeah, I was talking about the death rates. Why they are still coming up with the deaths.
Okay. The problem is the last year we saw the number of cases and that was the mild. Only few deaths were recorded. But this year we find more and more deaths. And that was because of the mutant virus that is circulating in our country. But we could have stopped with some basic principles. You know, virus is entering from a certain route, that is our nose and mouth. So if we simply follow a basic principle that we all put our mask, we use a 95 mask or even a 3-ply mask, that will help in preventing the transmission. The second basic rule is the hand hygiene. We should perform hand hygiene after every action, after touching anything that is suspected. And the third is the physical or social distancing. These three are the basic rules that applies on all such kind of diseases. But unfortunately, we are all aware, but we are not adherent to these things. We even say that we are only meeting to our friends or only meeting to our relatives, not meeting everyone. If you are meeting any single person other than yourself, other than the family member living in a room, then you are at risk and you are posing risk for others also. This time, what happened that this mutant virus has entered in our lungs and it has damaged, and lung is a vital part. Oxygen is required for every body organ. So once it is damaged, the supply of oxygen is limited. And once it is limited, and we are having some comorbid situation, like any comorbid situation, hypertension, any other cancer disease, or diabetes, or any chronic disorder, then we may land up into serious trouble. The problem was this time, this disease is for 10 to 15 days. It has its own course and it will go by that. So in this time we needed oxygen, but unfortunately the oxygen number of oxygen beds or oxygen supply, we were not prepared. The deaths happened due to hypoxia most of the cases. There was a lack of oxygen, people were gasping inside their houses, outside of the hospital, and we lost. Last year the case scenario was different. This time the mutant virus was more fatal than the last year. So last year there was a chance, why we study science, because to know past and to predict future. Unfortunately we were busy in some other stuffs or we could not focus on that. That's why we missed it. And now there's another bell ringing that the third wave might come. So this is the right time, we should take the steps right now, not once it comes.
Yeah, right. As you mentioned, Doctor, about the third wave, I recently there was a news regarding the fourth wave as well. I mean, the third wave has not yet arrived, and there is a news regarding fourth wave as well, which is the big part to coming up to the fourth wave directly. So, can you just tell what the third wave might include in it? Because in the second wave, we are facing a lot of crisis right now as well. I mean, loss of oxygen supply. People are needing oxygen. So, what third wave will come up with?
Third wave is basically the disease will have its peak, it will come down, and then it will have again peak. But in the third peak, it is expected that it might go for another mutation, and that might target to the younger population also. So
Yeah,
this is a very critical thing because for any country, either youth or their child are future of your country. And if they are in the morbidity situation or mortality situation, then your whole country may end up into serious trouble because these population, the children and the younger population, are supposed to be leading the future. So this is not much difference. This is only that the third time peak will come and the fourth time peak might come. And once the mutation happened in the virus, we cannot predict that how it will be
right.
tolerated by the population. It is only we can, just like many people are asking that if I would be vaccinated for the COVID vaccine, how long I will get the immunity. Since this is a very new vaccine, and the data, if we say that it will be safe for you for 6 months, 1 year, that comes after trials. So this is a very new disease, very new vaccine has been developed. So this is tough to say that how long you will have the safety from the coronavirus after vaccination, or how will the third wave will impact the population.
Yeah, definitely. Uh, is it like a part wherein the wave is containing of a target, like as at the first wave, it was mostly targeting towards the older age, and right now we are getting targeted towards the young age, or can say age between 20s and 30s or 40s, right? So it is as like as we can see a certain age criteria going on in the waves. Will this continue, or it is a signal to show ki, in the third wave it might contain to the younger ones, to the 18 age, like to the young generation of
Hmm.
India?
Uh, you can say that the first wave that came, that was the original virus, and that was not so powerful. So that could have damaged only the elderly population that having some problems already. The second wave came, then we were having some mutant viruses, and
Right.
once it was mutation, it was having more powerful. So it also involved those who were not in danger in the first wave. So it's not about the age group; it's about the power of the virus. Initially, it was supposed that it will not infect the infant or the children or the younger population. But as the mutation is coming, there might be cases when even a newborn may be affected. So that is not an age criteria from the virus itself. This is the mutation happening and it is getting more and more powerful. So that may affect uh, even a healthier population, even the younger population. That is the case.
Right, right, definitely. Okay, so could you just suggest like a medicine that can be used for the mild COVID symptoms?
The first and foremost thing I told you in my previous talk also, that this is a self-limiting disease. It has its own course of 15 days. Suppose like I have a symptom of fever or sore throat or cough, and if I take proper precaution, I will be fine after 15 days. There are some medicines that are found to be effective in the mild cases, and the government has given the guidelines that can be used even if you're at home. If you're positive, or even if you're having a suspected COVID or having symptoms, then you can use. The government has said that azithromycin can be used for 5 days, ivermectin can be used, doxycycline can be used, and you should also get vitamin C, zincovate, and some other immunity booster drugs that you should take. Use some people are using also kadha, Ayurvedic medicine, Unani medicine. That are the ancient medicines. The current one, that is the modern medicine we are using and treating. But the problem is not with the mild cases. The number of deaths that have created a news or havoc, or that has created a bad impact on the mind, was the moderate and the severe cases that needed admission. And there the treatment is totally different. Since we are not having any drug that can directly neutralize the COVID, so we are basically focusing on the symptomatic treatment. Either in the mild cases, moderate or severe cases. We are focused on the symptomatic treatment.
Yeah, right. Okay, so coming to the symptoms part, uh, like regarding the first set, the symptoms were natural, quite natural, like a viral. It was just having a cold, fever, throat pain. That were the symptoms. But right now, in the coming towards the second wave, the symptoms are getting worse and worse. I mean, having a back pain, having the body pain where the people cannot even get up. So such kind of symptoms are coming up. So can you just tell us about the symptoms that has been changed from first wave to second wave?
Basically, initially the symptoms were like you will be having fever, sore throat, cough either with expectoration or without expectoration, some kind of nausea also, body ache, some gastric disturbances, and the two peculiar thing was there, that the loss of taste and loss of smell. These things will also be found at this time also, but the severity has changed. Now you will have a body pain like you will not be able to wake up from your bed. That is the problem.
Right.
But that depends also on the severity. Like the last year, the cases were not having so much of the impact on the lungs. Right now, you will find everybody is going for the either CT scan or the X-ray to look after whether my lungs have been damaged or not, or how many parts are damaged, what percentage it is damaged. So that is because of the mutation in the virus.
Okay. So, like as we are coming ahead with the rainy season right now, people get infected to the viral, right? So, how can we identify whether it is a normal viral or a COVID infected person? So, how can we identify whether we are infected through a viral or a COVID?
Basically, COVID is also a viral disease, and it has a similar features like other flu viruses has. So, on the basis of symptoms, it is difficult to say that it is a COVID virus or a normal
Right.
virus. But there will be history of contact. Like if one person in the family is having fever and something, then he know that he was outside and without mask in some party or some home stuff or any important work that he gone out. The peculiar feature that is different from the normal virus in the COVID virus, that is there is a dyspnea. Like you have difficulty breathing, difficulty in exertion. Like once you will step up stairs, then you will find it difficult. You will be dizzy. That is very
Right.
different from the other viral viruses.
Okay. Right. That. Oh, I would suggest people to while we are coming towards the rainy season, people should always look after if they are going through a viral as well. They should like completely suggest a doctor and go towards it and take a complete precaution regarding it. So yeah, also coming towards the mask part, what do you suggest of wearing a cloth mask or the N95 or a surgical mask?
Okay, for that, you need to understand the first thing that if a person is positive, he is the spreader, I think. ठीक है?
Right.
And if I'm a healthy person, I'm the recipient. So we need a barrier. We need a barrier from its expulsion and from its receiving it. So basically, mask is preventing from the infected person also and the from healthier population. It is very important for infected person to wear a mask, and it is also same importance in the healthier population because it's a two-way process. Like if I am healthy population people and I am not wearing mask, and I am saying that only infected person should wear, this is not going to stop. We both have to have wear the mask. The mask category may different. That it is said that a normal cloth mask can also be effective. It's better to wear a three-ply mask, and if you can afford, better to wear a N95 mask. That is, its manufacturing process has given us some advantage over the other mask. So, but it is important that both should wear the mask,
Yeah.
even healthier population and the infected person also, to stop the transmission.
Okay. So, uh, how like as we are having a shortage of oxygen as well, how frequently is the oxygen required to the people, and is it like every people requires oxygen?
Uh, you know, only 15% will come up in moderate to severe category, Rest 85% would be uh, getting better at their home places, and even more than 60% would never know that they have gone to the COVID. They would have some symptoms, but they will not find any difficulty. Only 15% will be having moderate to severe category, and 5 to 10% may need hospitalization. Since our country has a large population, we have more than 100 crore of population. So even a 1% of our is very difficult to handle, and the
Right.
severity is in the 15%. That is the problem with us, that we are having the infrastructure, the government infrastructure of 1947. Our population has gone very much, but we have not matched the health infrastructure in that ratio. This is the problem.
Right. Okay, so what do you suggest to the people out there to, control by going outside? If they, like if they're going outside as well, what are the precautions they should be taking in?
I think everyone loves their life, and everyone want to live in this world. Yeah? There is no
Right.
one who would like to die, but there's some who need to earn something, or they have some emergency work. They have to go. But my suggestion is, if you have any emergency or any such kind of problem, you may uh, follow the government guidelines, and it is very important to wear mask and having hand hygiene and maintaining a distance. I am repeating once again, this is very important in stopping the transmission. Providing oxygen bed is not easy, but wearing mask is easy. This needs a behavior change in ourselves. The government or the health facility officers can direct, but they cannot check the every Indian that he or she or is wearing a mask or not. She or he is performing hand hygiene or not. So it is our duty that, and it is our life, and it is our people. So we should also follow the rules and contribute in the
Yes.
country's development by this.
Yes.
If
Right.
I'm healthy, it is my contribution for my country. And if
Right.
I'm ill, then our government or our own money will be utilized for my treatment. That is not good.
Yes, definitely. So, doctor, also as we have started, India has started with the vaccination process as well. There are many people after a first dose of vaccination or a second dose of vaccination, we are having some body pain or a pain we are going through a day. So, what a medicine should you would be suggesting for such cases?
Okay, first of all, the vaccine has already said that there are some minor side effects of the vaccine, because in the Covaxin it is a real coronavirus, but that is a kill, and in the Covishield that is processed by the chimpanzee RNA virus, and that has an mRNA of the real coronavirus. Okay, so you will have some corona-like symptoms in some cases. So if you have a fever or a body weight, then you can use a plain paracetamol depending on your weight. If you are less than 50 kg, you can have 500 mg for the 3 or 4 times. And if your weight is more than 50 kg, then you can use paracetamol 650 mg for 3 times or 4 times a day. That is enough. In most of the cases, it is found that the body ache or the local side pain or the temperature is relieved within 2 to 3 days.
Right. Okay, sure. So also, doctor, today the guidelines were passed, like there was a change in the guidelines regarding plasma therapy, said as plasma therapy won't be continuing again for the COVID relief, COVID-19. So for that, why do you think plasma thing has been stopped? Because as far as I know, plasma was being said yes for as people were recovering through it, through the antibodies. So why is that change by saying a no to plasma?
Basically, corona is a new disease for us. So we have tried many things, and one of those trial was using the plasma of the recovered COVID patient. But for the whole 1 year, this was done in many patients, but it did not have any different impact, that whether we are giving plasma or not. So that is why it has been continued, that people are running here and there to arrange in plasma, and the scientifically it could not be proven that it has any extra benefit. So that's why the plasma therapy have been discontinued. Like some other day, if I say that now this therapy should be used, so since it is a new disease, we can try, we can go for the clinical trials, but its effectiveness is not by my saying, that has to be proved, that has to be proven in the clinical trials, and that could not be proved in the case of the plasma therapy. That is why it has been discontinued.
Okay, so plasma therapy is not impactful for COVID-19, can be said as. Okay. So also there are some things happening where people are coming up with Ayurvedic kadas as well, that they are helping out as well to recover. So do you really think that Ayurvedic kadas do help us in COVID for the like home treatment? Wherein if I am feeling low at certain point, I am having a
Hmm.
throat pain right now, I'll be drinking kada and will be okay. So do you think about it?
First, uh, first of all, I have not studied the Ayurvedic, but I know that Ayurvedic medicine is an old and ancient medicine of this country, the same like other, Unani medicine, and they have their own benefits. Even the modern medicine has been derived from these ancient medicines. So it is undoubtedly, I can say that there are some benefits, but that can only be dealt in the mild cases. You should not try in the moderate and the severe cases. That
Yeah,
because that needs an urgent attention.
right,
It is helpful, and it is helpful in the mild cases, and I said that percentage of mild cases is 85%. So
right.
you can say that it might work in the mild cases, but my personal suggestion is, if you are having any moderate to severe conditions, don't wait for it. Go to your nearest center and contact a modern medicine practitioner or allopathy
Yeah,
practitioner.
right. Also, it's been said by many people out there on the social media platforms that during menstruation, females shouldn't be going towards the vaccination part. It will create a weakness in their body as well. So, do you really think it will create a weakness after taking the vaccination during menstruation?
I can comment on the lactating part and the pregnant part. Since I am searching for the research papers to study on that, and I could not find much data on that. So my comment would be opinion, not a scientific fact. So when you go for the vaccination, there might be some pain, some fever, some body ache, and since this physiological process already involved, that the females know that there are some weakness and some chidchidapan and all that. So at the same time, if you have vaccination, the two factors may come together, and that may worsen.
Yeah,
But it has to be proven scientifically in the coming research papers.
right. Okay. Also, it has been said that like vaccination is creative weakness. So is it in a good way? Like obviously it's a vaccination where it is having a more impact as well. So is a vaccination being a part wherein we'll be feeling low for 2 days and it will be impactful? Like after the vaccine, it will be impactful for us. Is it impactful?
In the study, it has found that vaccine is effective. It's not that you will not get infection again if you're vaccinated. You might get the infection, but our body will be ready to fight. It will be not for the first time that the live virus is coming. If we are vaccinated, my body will be prepared. It's like the same that you go to a learning class and learning the driving a car, and in the second case you are directly driving your car. So that have two different things, na? Like once
Yeah,
if I
right,
have vaccine, my body is already prepared. So if live virus will come, my body will act like that, and it will prevent me from going in a severe condition, you know. And that
right,
weakness is not weakness, because since it is a vaccination process, your body is getting prepared for, you can say, like a war. So there might be some minor side effects, and that is not weakness at all.
okay. So what are the precautions you would suggest after the vaccination a person should carry on with?
First of all, before vaccination, you have to assess your own condition. Like if you have any history of drug reaction or anything, then you should inform your doctor. Or if you are having an active fever, like I am having fever, but I'm saying no, 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 it's not COVID. No, get it checked, get it checked. Wait for a few days. If it is COVID, then wait for at least 1 month. है ना? If you are having some cancer drugs, or in some immunocompromised state you are, then you should consult your doctor, and you can avoid vaccination, because vaccination will benefit to some, but might be harmful. So if you are having any immunocompromised state, or going through some serious medications, or having some drug history reaction, then you should contact your doctor. The
Yeah.
second thing is, after the vaccination, you should wait for at least half an hour once vaccinated, and uh, see what is the changes you will find in yourself. If any symptoms, note it down. If any severe thing that is coming to you, then report to your nearest health facility. In million of cases, both the vaccine have reported only mild to moderate side effects, and severe side effects have shown only in 1 in 10 lakhs.
Right. Okay, so lastly, I would like to ask you, what are the precautions you would like to tell to each and person out there, if they are going out as well or they are at home as well, that has to be continued uh, till the COVID is, totally out of India or out of the world, as we can say. So yeah.
I will once again repeat the three basic things that will save you even without a medicine from COVID. The first, wear the mask. It will block the route of entry of the coronavirus in your body. Second, perform hand hygiene after touching any suspected item, or even make it a practice of having hand hygiene before doing anything. And the third, maintain a social distancing. These three principles, it does not need any intervention. It does not need ventilator. It does not need oxygen. Without on ventilator, without oxygen, without any medicine, we can fight coronavirus if we practice three basic things: wearing mask, performing hand hygiene, and maintaining a social distancing. This is my message to all.
Yes, definitely. Thank you so much, Dr. Salim, for joining us in teleconsultation. It was really nice to talk to you regarding COVID, as we have got enough knowledge regarding COVID from you. Thank you so much, Dr. Salim, for joining us for the teleconsultation. I would like to say to
Thank you,
all the
sir.
people out there, yes, thank you. So I would like to say each and every person out there to stay home and stay safe. It is for us, it is for every individual out there, it is for our family, it is for the nation. So guys, stay safe, stay home. Thank you.